Hi everyone and welcome to this 6-part educational series. Today we'll be going over children's teeth. To watch all of the videos before they're released on our channel, make sure you download the My Dental Care app, either from the Apple Store or the Google Play Store. Let's get into it.
In this video, we're going to be talking about children's teeth and its treatment. If you're here for anything in particular, feel free to skip around using the timestamps on the screen now.
We'll start by discussing the oral health for children aged 0 to 6 years old. For children aged 7 and above, feel free to skip to the timestamp titled, "What is the prevention advice for children aged 7 to 12 years?"
It is really important to start at a young age to encourage good oral hygiene habits so that your child can maintain this and carry on onto adulthood. Unfortunately, in the UK, almost 25% of children aged 5 years old have tooth decay. So that's 1 in 4 children will have decay when they start school. Tooth decay is preventable, and hopefully by working with your local dental team and using the guidance from this dental app, we can help reduce this figure.
As soon as their baby teeth first start to appear, they should be brushed twice a day using a small, soft toothbrush with the right amount of toothpaste, which is appropriate for their age. You should brush your child's teeth until around the age of 3. After this age, you should start to encourage them to brush for themselves with parental supervision until they're about at least 7 years of age. Try to make sure that they're cleaning all the surfaces of their teeth using the right amount of toothpaste and discouraging any licking or eating of the toothpaste.
Ideally, you want to sit your child on your lap with their head held against your chest, using a soft children's toothbrush with gentle circular motions to brush your child's teeth. Remember that the toothbrush should also reach the gum areas while cleaning the teeth. After age 3, you should start observing and supervising your child's brushing, making sure that they are cleaning the biting and inner surface of their teeth just as well as they are brushing the front surface of their teeth. Remember that bacteria cannot tell the difference between their beautiful smile and the areas that people can't see, so we must clean all these surfaces equally.
It's important that their teeth are brushed twice a day to help prevent tooth decay. Brushing must be done just before bedtime, as it is essential not to leave food particles and dental plaque or bacteria on the teeth overnight. Your saliva helps to protect against tooth decay. However, at night, there is less saliva in your mouth. So if your child has a sugary item just before going to sleep, or forgets to brush, their natural saliva protection will be lower and the bacteria will be permitted to attack all their precious teeth all night long. Over time, this can cause tooth decay.
From the ages of 0 to 3, it is recommended by Public Health England that your child should be using toothpaste which contains a total fluoride concentration of at least 1000 parts per million, and you can find this information on the back label of the toothpaste. You should only be using a smear-sized amount of fluoride toothpaste, and the reason we use this proportion is to help reduce your child from swallowing too much toothpaste.
From ages 3 to 6 and above, the recommendation is to use a children's toothpaste which contains a fluoride concentration between 1350 parts per million to 1500 parts per million. You should only use a pea-sized amount of fluoride toothpaste.
It is important not to rinse their mouth out with any water or mouthwash after brushing their teeth. This is because the fluoride in their toothpaste is fantastic for their teeth as it helps strengthen the enamel and prevents tooth decay. So you don't want to wash out this beneficial toothpaste only after 2 minutes.
Your child's first teeth should start to appear around 6 months of age. By 3, your child should have all their baby teeth, which are 20 in total. On the screen now is a table of the average ranges of when your baby's teeth should start to appear. It also shows the age ranges in which these teeth should naturally fall out. Bear in mind that this is only an average and it can be completely normal if your child's teeth do not follow this pattern. Your dentist will be able to give you more guidance if this is the case.
The British Society of Paediatric Dentistry recommend that all parents and guardians ensure that young children in their care are taken to see a dentist as soon as their first teeth start to come through and before their first birthday. This is a nationwide campaign called Dental Check by One. It is unlikely that for there to be any significant health concerns at this young age. However, it is important for your child to become familiar with the dental environment and your local dental team. This will help your child build trust and confidence with your local dental team and allow your child to be more relaxed to the sounds and smells of a dental clinic. Your dentist can also assess their oral hygiene and give guidance as required.
Many adults become anxious about visiting the dentist, and some studies have shown that this can be from an unpleasant experience from a young age. This is why it's important for your child to develop a good association with the dentist. It is essential to prevent problems before they arise, and this all begins with regular dental visits from a young age.
The reason why children sometimes need fillings is because they have developed tooth decay in their teeth. And this is usually a result of having too much sugar in their diet too often. Tooth decay means that they have developed a hole in their tooth, and if left untreated, it can result in pain or infection. By reducing the frequency of having sugar and by the placement of a filling, we can stop this hole from getting bigger and doing more harm to the tooth.
The sugar may not necessarily be from having too many sweets, as you might be surprised how much sugar there is in everyday food and drink items. There is an app created by Public Health England which can help show you the sugar content of different foods and guide you on appropriate daily amounts for your child. This can help to prevent tooth decay.
We're not trying to say that your child can never indulge in a chocolate bar or have no more sweets. However, it's about understanding the timing and finding the right balance for your child in order to protect their teeth. Please see our diet and teeth video to better understand the relationship between sugar and teeth and tooth decay. That video also contains some great tips on how you can prevent tooth decay through their diet. Also, I just want to note that you should never leave a child with a bottle containing anything sugary overnight, as this can cause tremendous amount of damage to their teeth quite quickly in a small amount of time.
Baby teeth are very important to your child's health and development. This is why it is essential to prevent tooth decay, as it can lead to dental pain or infection, which can affect the adult teeth developing underneath. Baby teeth maintain the space required to help guide the adult teeth into the right position. Teeth love to be next to each other, so when one's removed early, the other starts to drift to fill that space. Consequently, there may be not enough room for the new adult teeth trying to erupt through. This may result in your child requiring orthodontic treatment or braces when they are older.
Your child's first adult tooth should start to appear around the age of 6. This is the beginning of the mixed dentition phase, which simply means that your child will have a mixture of adult and baby teeth until around the ages of 12 to 13. On screen now is a summary of some prevention advice for this age range. Once all the adult teeth have completely grown through, about the ages of 12 to 13, your child should start looking after their teeth like any other adult. Have a look at the oral hygiene guide video for more details.
In these unfortunate cases, your child has too many teeth with large amounts of tooth decay. Unfortunately, these teeth cannot be saved with a filling and need to be removed, as it will cause more harm to keep them.
Unfortunately, in the UK, the main reason for a child to require an operation under general anaesthetic, which means that they'll be put to sleep, is for the removal of decayed teeth. The whole process can be very upsetting and difficult to go through for everyone involved, especially considering it may have been prevented and avoided in the first place. In the My Dental Care app, there is a link to a short 2-minute video created by Channel 4 showing the steps involved in the general anaesthetic process for the removal of children's teeth. Bear in mind that this can be very difficult to watch and contains scenes of a surgical process.
Children who suck their thumb throughout the day after the age of 6 are at risk of developing dental problems in their adult teeth. Prolonged thumb sucking can push your child's erupting front adult teeth forward, making them protrude out. This can permanently affect the position of their front teeth, affecting the aesthetics and putting their front teeth at an increased risk of trauma due to knocks or falls. A similar problem would be the prolonged usage of a dummy, which would have the same effect on their developing teeth.
The longer the thumb sucking or dummy usage continues, the more likely they are to need orthodontic treatment in order to realign their front teeth. If you have noticed this habit as your child approaches the ages of 6, please try to discourage them, as this is the best time to do so.
The chewing surfaces of molar teeth have these fissures and grooves which can be difficult to clean thoroughly. These are areas which are more prone to trap dental plaque or bacteria and food particles, which can lead to tooth decay. These fissures and grooves can also pick up stains, making them appear black. These are the dark lines seen in the center of the molar tooth.
Some people's molars naturally have very deep fissures and grooves. Your dentist may wish to place a protective layer to seal these grooves and fissures to help prevent tooth decay. This is called fissure sealants. They can wear over time, however, your dentist can easily replace them.
To see the placement of a fissure sealant, make sure you check the link in the app.
The following is the exact recommended advice from the British Society of Paediatric Dentistry. The earlier weeks of your baby's life are straightforward, with milk being the sole food, either from breast or bottle. Breast milk or formula milk will meet all the baby's nutritional needs for the first 6 months of their life. Around the age of 6 months, you can start to encourage your child to drink from a free-flowing or open-top cup, so that bottle usage does not continue past their first birthday.
In terms of food and drink for toddlers, Try and keep drinks and food to meal times and avoid giving your child any food or drink with the exception of water within an hour of bedtime. Aim to limit food and drink that contains sugar, including those which are said to be healthy, such as dried fruit, which is sticky and clings to the teeth and can be damaging to the teeth if frequently consumed between meals. Water should be made regularly available for your child from the age of around 6 months. So your child is less likely to get tooth decay if you just give them water in between meal times.
For a much more in-depth explanation of how diet can affect your teeth, please check out our diet and teeth section or look at our diet and teeth video.
So that's everything you need to know about children's teeth. We hope you found this video useful, and if you did, then feel free to check out the other videos in the app and subscribe to our YouTube channel for more. Take care, and we'll see you in the next video.
Thanks for watching.